Thank you very much.
You're welcome. Thank you for keeping to time. A round of applause for her, please. Thank you. We have another interest group joining us, and that is Cpan, Clinical Pharmacist Association of Nigeria, your chime. A round of applause for him, please.
Good morning, distinguished colleagues. My name is Dr. Ejiro Akpon, and I'll be speaking on behalf of Cpan, which seeks to advance direct patient care through clinical pharmacy. Now, Cpan was bettered because of the response to the need to drive clinical pharmacy practice in Nigeria. And we aim to support and encourage excellence, partnership, and leadership within clinical pharmacy practice in Nigeria. We have our presence in 33 states of the Federation and across the world, the US, Pakistan, India, UK. We have members all over the world. Cpan is driven by Pool of Experts Committee, whose membership is drawn from distinguished members of ACPN, the community practice, the hospital practice, academia, the industry, and the diaspora. Now, Cpan has been involved in uninterrupted clinical meetings for the past 2 years of its existence. Over 100 clinical meetings have been held both at the state and national level. And our resource persons are drawn from within and outside the country. And from outside the shores of this country, we've had resource persons from the US, our own Dr. Teresa Pounds, the president of NAPSA, who is also a member of the pool of experts. We've also had presenters from the UK and from Pakistan. Now, Cpan is also involved in training pharmacists to acquire skill sets to bridge the gap, the clinical need, the clinical role of the pharmacist in patient care. And Akwa Ibom State Cpan has been involved in the training of pharmacists for IV administration. Cpan have launched its inaugural edition of the National Journal for Nigerian Journal for Clinical Pharmacy and Therapeutics. And we've also been involved in series of advocacy and enlightenment workshops in radio and on TV. We are very active in the social media space. We have our active website, cpanworld.org.ng. So please check that website out.
Thank you. Time up. A round of applause for him, please. And the last to come is the Association of Hospital and Administrative Pharmacists of Nigeria. A round of applause for him, please. Thank you.
The chairman, colleagues, good morning. My name is Pharmacist Akelekunu Gabriel. I'm making the presentation on behalf of AHAB. During the year under review, we had engagement with government to strengthen the drug revolving fund. And I want to tell you that the government has released circulars to strengthen the drug revolving fund in our hospitals. We also engaged Nigerians during the COVID pandemic, the first wave, the second wave, and the third wave. And our colleagues made presentation. We have this collaboration between AHAB and Channels Television to tell Nigerians on the effect of the cocktail of drugs that are used to manage COVID-19. And our colleagues too made extemporaneous preparations during this period. Hand sanitizers were made that were used by various hospitals. We also had research program within this period, and at our last conference, over 21 of our colleagues presented their research work during the conference. We also had publication in Nigerian media, newspapers, the Guardian newspaper, the Vanguard, and other newspapers, telling the government, encouraging the government to see how they can utilize the knowledge that we have as pharmacists. Thank you so much.
20 seconds. You have 20 seconds more.
So we also have activities in our various states. Where all the states had AHAB week, and during this week we had engagement with the community that we serve. We had drug enlightenment work, we had outreaches, and we reached out to Nigerians to treat small ailments and there were referrals to
Time
hospitals.
up.
Thank you so much.
You're welcome. Permit me, distinguished ladies and distinguished pharmacists, to call on the Nigerian Association of Pharmacy in the Academia. A round of applause for him, please.
Good morning, colleagues, ladies and gentlemen, the presidents and the whole house. I'm presenting on behalf of Nigeria Association of Pharmacists in Academia, NAPA. NAPA comprises all pharmacy lecturers in all our accredited university and faculties of pharmacy or pharmaceutical sciences. We'll start this way. Last year when we were at Osogbo, we visited the Vice Chancellor of the Obafemi Awolowo University, and we have also visited some other Vice Chancellors to provide advocacy for our members and our faculties. So if you see improvement in the pharmacists that have been trained, it's because of the activities of NAPA in their respective institutions. Again, so we have the pictures of the Vice Chancellor and the members of NAPA of OAU and other members at last year, Maluabi 2020. Again, we now have a change in executives because we have changed the place of hosting. So our campus, our secretariat is now in OAU. Started from August. So we have
20 seconds to go. In August, we have our conference in Nsukka, and we also have a lot of achievements in that conference where we intimate members on how to practice and progress of pharmacy professions. Time up. We want
Thank
to
you
thank
so much.
very
God
much.
bless you.
Thank you very much. Mr. President, sir, and distinguished pharmacists, we would like to thank you for giving us this opportunity to showcase the technical groups and the interest group here at the AGM. For the first time in a long time, all the technical groups and the interest groups are present. A big round of applause for everybody. Distinguished pharmacists, I would like to tell this AGM that they are going to be judged on punctuality, their display at their stands, their mode of dressing, presentation, the content of their presentation, and their communication skills, and their presentation, the relevance to the practice of pharmacy, so that by the time we collate their scores, you too, you will be able to score them. You've seen them and their presentation and everything, and you can visit their exhibition stands right here in the hall so that you will be carried along 100%. I, pharmacist Abiola Aino Okewo, FPSN, want to thank the president for giving the technical groups and the interest group the opportunity to showcase what they have done in the year 2021. Thank you. We'll step down now and then we'll go and collate the results. And the result will be passed on to the president, and the result will be announced later at the dinner for their awards. Thank you very much, sir. Attention, please. An ID card of Abdusalam Rukaya was brought to us, and you know you cannot vote without the ID card. If anybody is by the name Abdusalam Rukaya, they should please come and collect the ID card from the National Publicity Secretary. Pharmacist Ijoma will be giving this. Thank you very much.
of the Pharmaceutical Society of Nigeria, Garden City, 2021, holding here in Port Harcourt, Rivers State. As we know, we're going to get on with the proceedings of AGM very soon, in which elections will hold and new officers will be elected. But we have lined up one or two things to take, which we're going to manage within the next maximum of 15 minutes so we can get this process on, because we know that Anambra State is holding elections tomorrow, and at a particular time there may not be movement. So we are very concerned about our colleagues coming from that state. So right now, before we take the company presentations, I will yield the podium to Professor Emmanuel Ibezim to use 2 minutes maximum to do his presentation. Professor Ibezim, sir.
Thank you. President of PSN, NEC Council, and colleagues. It's a dream that started 15 years ago, precisely, as a young professor in faraway Rio de Janeiro, Brazil. I delved into my archive, Rio de Janeiro, Brazil. I delved into my archives and discovered that law has law dictionary, medicine has medical dictionary, nurses have nurses dictionary, architecture has architectural dictionary, but pharmacy has no dictionary. So I started a project 15 years ago to produce a dictionary for pharmacy. And for the first time, I came up with a beautiful, well-colored, well-articulated, Nigeria-represented pharmacy dictionary. And it is my pleasure to present this first ever pharmacy dictionary to this hallowed house. It's my desire that you will patronize it. Every pharmacy home should have one in place. Thank you very much, because I know you will subscribe to it. The cost price is just 1,200, but you can do more than that. Thank you very much.
Yes. Sir, is that yours? Is that yours? Thank you very much. Please, the dinner tickets are still being sold, and we have decided to do buy 10, get 1 free. That's a lot. And I want to also inform us, ticket is already discounted, because for more than 5 years, dinner ticket has gone for 5,000 naira, and then a bag of rice was 8 or 11,000 naira. Now it's 34,000 naira. Groundnut oil used to be maybe about 11,000, now is almost 30,000 naira. So we can agree that it is already discounted. And we're almost running out of cards. Please let us know that cards will not be sold at the venue. So you have the opportunity now to pick up 10 cards and get 1 for free, so that we wouldn't have to struggle to get cards at the venue. Thank you. So right now, Vitabiotics, are you ready for your presentation? Vitabiotics. Oh, sorry, I think that should be Mega Life Sciences and Boringa. Any of you that is ready can come up and do the presentation in the next 5 to 10 minutes. Which company? Mega Life? But I don't have you here. Okay, you can come and take your presentation. Thank you. But before then, Professor Reba, please, in 1 minute, come and make the announcement. Vitabiotics, your time starts now, so step up.
Thank you very much, the President and my distinguished colleagues. I bring you warm greetings from the President of the West African Postgraduate College of Pharmacists, the distinguished Professor Cecilia Iguilo, and also greetings from the members of the Council of the West African Postgraduate College of Pharmacists. WAPCP, as you all know, is a postgraduate training institution dedicated to training pharmacists to become specialists in their areas of endeavor. And there are different countries in West Africa: Gambia, Ghana, Sierra Leone, and Nigeria, and Liberia. And we are making efforts to also integrate the Francophone countries in our college. We are very proud to invite you all to the forthcoming annual general meeting of the West African Postgraduate College of Pharmacists, coming up May 2022. Nigeria is hosting, and we invite you all to be there physically. We are expecting a very successful event. Thank you very much for your audience. Thank you.
Thank you very much, Professor Oriaba. Please, we apologize that the media crew, they've been losing their items here on daily basis. Today, we can't even stream most of the things happening here because a major cable connecting the screens have been removed again yesterday. So we apologize for that and continue to, encourage all of us to continue in nation building by advocates. I don't know people who are doing this kind of wickedness in a conference like this, maybe because they've been given opportunity to come in and assist with one or two things, and they're cutting things away. That's very unfortunate. So we apologize that we're going to make do with what we have so that the conference can continue. Thank you. So Vitabiotics, you have 10 minutes.
Good morning, everyone. My name is Pharmacist Taiwo, and I beg to stand on all protocols duly observed, please. And I'll be going with my slides, although there's no large screen, but I hope you can follow me. We've already made effort to share some of the flyers of the products. I'll be presenting on our Visionist from Vitabiotics. So Visionist is our eye supplement, our eye multivitamin. So at Vitabiotics, we believe that seeing is believing. So seeing is believing, that's why we have Visionist. So that no matter what age you are, you will not have any problem seeing clearly. So we have different eye disorders, as we all know. There's what is known as age-related macular degeneration. There's also cataract, which is very, very common. There is glaucoma, which is another common eye disorder. And there is marginal dry eye, which is less common than the other two. So for talking about age-related macular degeneration, we all know that there is the macular pigments in the retina of the eye, and the macula is a part of the retina at the back of the eye and is responsible for central vision, color vision, and fine details of what you see. Yellow, it is a yellow oily substance composed majorly of lutein. Lutein is a carotenoid, which is an antioxidant in the eye that helps to improve vision. And lutein is naturally occurring. Lutein can be found in eggs, it can be found in fruits and vegetables. So for those of us here that actually eat balanced diets, which contains the eggs, fruits, and vegetables, you are not likely to have much vision problems until much later in life, maybe from your 50s, in which there is now more increased chances of having glaucoma or cataracts. And the lutein is also found in the macular region, as said earlier. Talking about age-related macular degeneration, what are the symptoms? The symptoms include glare sensitivity. That means there will be problems seeing clearly. There's also decreased color and contrast sensitivity. So that's why you see some people in their 50s or 60s, they cannot differentiate colors very well. They cannot see clearly. It could likely be due to age-related macular degeneration, as the eye doctor will actually diagnose. Age-related macular degeneration is also characterized by degeneration of the small spot in the center of the retina, which is known as the macula. So there is a small spot in the center of the retina that is known as the macula. And antioxidant levels in the eye appear to be significant to the progression of age-related macular degeneration, AMD. So the lower your antioxidant level in the eye, talking about the lutein, the zeaxanthin, and all the other carotenoids in the eye, the higher your chance of having age-related macular degeneration. Talking about cataracts. Cataract, as we said, is very common. And what are the symptoms of cataracts? We have blurred vision, we have sensitivity to glare, and we also have less vivid perception of color, with objects possibly taking on a yellowish tint. So you have some elderly people, they complain that they cannot see clearly, or they are getting higher sensitivity, and there is less vivid perception of color. They cannot really see color clearly. What are the risk factors for cataracts? We have age, like we said, advancing age, family history. So if you have a relative that has had cataracts, there's a higher chance of you also having cataracts. There is the genetic factor, there is radiation and light exposure. So the lights from our mobile devices, the light from the sunlight, the UV rays, and also diabetes is a risk factor. Smoking, for those that smoke, they have higher chances of cataracts. Those that consume alcohol in large excess quantity, and also those that consume corticosteroids, as well as poor nutrition. So all these risk factors can predispose one to cataracts. The age, the family history, and co. Marginal dry eyes, like I said, dry eye occurs a lot. And dry eyes occur when there is either the eye does not produce enough tears, or when the tears evaporate too quickly. The form of dry eyes observed in non-contact lens wearers is commonly referred to as marginal dry eye. So the marginal dry eye occurs a lot in non-contact eye lens wearers. Talking about glaucoma, glaucoma, according to the WHO, accounts for 12% of global blindness. So 12% of global blindness is caused by glaucoma, which is why it's very important to talk about glaucoma. And glaucoma is actually a group of diseases that damage the eye's optic nerve, as well as and can result in vision loss and blindness. So glaucoma is actually very serious, and it's important that we all go for our eye checks regularly so as to prevent us from coming down with glaucoma. And however, vision loss can be prevented with early detection and treatments. So treatment, the early detection of glaucoma is very important, and there's also treatment for it. So treatment options for all these eye disorders include, for glaucoma and cataracts, we have surgery, and there are also some oral and topical drugs that can be used for these eye disorders, as well as antioxidants, which can help to improve vision as you age. So the antioxidants can actually prevent the occurrence of these eye disorders, especially in people that have a family history. And like we said, it's very important to eat good nutrition. I've been seeing a lot of people here, especially the kind of canteens and restaurants that are around. They sell very healthy food. And we also have those that even sell smoothies and fruit juices. So I want to recommend that we should actually imbibe the culture of eating good food. I mean, as Lagosians, Nigerians, we get to eat a lot of junk food, a lot of fatty food, food with bad oil and all that. Let us patronize those with low fats, those with good oil content. And in continuation, I would like to introduce Visionis. Visionis from Vitabiotics. I'm sure a lot of us here already know Visionis, which is the #1 eye supplement, which is recommended to improve your vision and to help to prevent the glaucoma, cataract. So Visionis is a comprehensive research-based formula developed to provide nutritional care for eyes and vision. Visionis contains the AREDS2 formula. What is AREDS? AREDS is a study that was done, known as age-related eye diseases study, that was done, and the formula for that AREDS2 shows that any good eye supplement should contain vitamin C, vitamin E, zinc, copper, lutein, zeaxanthin, bioflavonoids. Lutein and zeaxanthin are actually antioxidants, which are carotenoids found in the retina, as I mentioned in my previous slides. We also have pro-eye vitamins, vitamin B1, B3, We have the pro-eye minerals, magnesium, selenium, iodine, copper, and we have chromium. And these are all contained in our Visionist. There's also the importance to add omega-3. Omega-3 that contains the fish oils, the EPA and DHA, which helps to also improve vision and to also help to slow down the occurrence of cataract and glaucoma. That can be found in our Visionist Plus, and it is backed up by this study known as the ELIPSA study, which is effects of lutein in photopic and scotopic aging. And that study used Visionist Plus as a sample drug. And the results of the study showed that they did the double-blind study, the placebo group and the lutein group. The lutein group was given lutein, which is the antioxidant. And the result of the study showed that there was 68% increase in vision for those that used the lutein group versus those that did not use lutein. And like I mentioned, the Visionist contains chromium, manganese, vitamin E. The importance of vitamin E for the eyes is that it is a major lipid-soluble antioxidant of retinal membranes, and it's shown to help prevent AMD, age-related macular degeneration. The Visionist also contains the carotenoids and co. And Visionist helps to impede the progression of degenerative macular changes. It helps to retard age-related patterns of lens breakdown. It helps to maintain normal moisture. And it also helps to increase the macular pigment density, as well as preventing accumulation of drusen in the eyes, which can cause glaucoma or AMD. Thank you very much. And we hope to see you at our stand, where you can get more of the Visionist and even some free sample packs. Thank you.
Thank you very much. Let's encourage them. Thank you. If you have questions, you know their stand, you can get there and ask the questions. The president of the Pharmaceutical Society of Nigeria, Pharmacist Mazi Sam Ohuabunwa, FPSN, NEC, past presidents, fellows of the Pharmaceutical Society of Nigeria, fellows of the West African Postgraduate College of Pharmacists, colleagues. We are getting into the AGM right now, so I will, with every sense of humility, request that the president in council, the president of the Pharmaceutical Society of Nigeria, steps up to the stage. President is coming up. And all members of NEC, I am not waiting, Dr. Ejiro, please, we have to continue. Anambra will have to leave. Yes, we'll be doing it here. Stage, because we're going to kick off the AGM right now so that Anambra State can do and leave. Now by my time, I think it's 11:30 on the dot. I'm believing that the way the president has been pushing, that before 12, before noon, Anambra State would have left here. Thank you very much. While we're waiting for the president to step up and members of NEC take their seats, we know that we're going to Jos Plateau in 2022, and you can see them wearing those beautiful attires. If you're interested, please contact them. It's already made, and I think you can get one for 10,000 naira only. Remember again that the dinner tickets are still on for sale, and after now, we were not going to sell tickets at the venue. It's still 5,000 naira, which I insist is highly discounted rates given at the rate of inflation in the country today. But buy 10 cards and get one for free. We still have a lot of lost but found items. This one belongs to Oyenoga Adewale Bami Dele, Lagos. So anybody who knows him, or if he's here, he could step up and collect it. I also have another name tag. This one belongs to Abdul Salam Rukaya, Niger State. Is still here for pickup. Remember, and also the lighter we picked up. So if any of these items belongs to you, please step up. And Wale Oyenoga. Yes, okay, thank you. So with that, the President, I yield the podium for you to continue the proceedings of the AGM, sir. Thank you.
As men of honor, good morning, very distinguished pharmacists, past presidents, past chairmen of board, fellows, new, old, incoming,